almost 3 years since the Tobacco Products and Electronic Delivery Systems Control Bill was tabled in Parliament. It aims to regulate the sale, advertising and packaging of both tobacco products and electronic delivery systems, including nicotine and non-nicotine products on the market. The bill also proposes to declare indoor public spaces and certain outdoor areas as 100% smoke-free. So let's unpack the story now. We're joined by Dr. Kgosi Letlape. He's an ActionSA MP and he's also a harm reduction activist. Dr. Letlape, it's great to talk to you. Thanks very much for joining us this afternoon. It's a contentious issue, isn't it? Because I think non-smokers and perhaps even former smokers will be on board with this issue of banning smoking in any area that is publicly acceptable.
Good morning to you and good morning to the viewers. I'm not too sure whether it has to be a contentious issue, but the way it is being proposed, it's in a contentious manner. I think one of the key problems with the bill is it wants to create safe spaces for non-smokers. And it forgets that the way you make it safe for non-smokers is to also make it safe for smokers. Have designated areas where people who smoke can smoke amongst themselves. Now, what is being proposed, it's almost like writing them out of existence, taking them out of all internal spaces and taking them largely out of public spaces. The question that I ask is, where would it be safe for people who smoke to indulge in what they enjoy? And that is where the problem lies. It should not be created such that it's a contestation and a war between people who smoke and those like us who choose not to smoke.
Yeah. I mean, I hear what you're saying, Dr. Letlape, but if we're sitting in a public space, let's say on a curb outside having a coffee, and someone sits at the table next to us and they light up a cigarette. You know, the question is, why should I be exposed to that secondhand smoke? Can the smoker not find another place to light up?
You are correct, but the smoker is a consumer too. Why can't the owner of the place create a place where it is safe for them to smoke and we are away from their secondary smoke, as had been done before, where there were indoor areas? But you can create spaces far away. Remember that the smoke dissipates after a few meters. So it's the proximity that puts you in harm's way. So there could be spaces that are dedicated to those who smoke. We can't write them out of existence. In terms of our constitution, people who smoke are human too. And the rights that we have as humans accrue to them too.
Yeah, and the argument that you made in the articles you've written on the subject before is that the bill that we talked about in the introduction to our conversation doesn't only regulate the industry or regulate the spaces in which smokers can light up, but also criminalizes them, in some cases even harsher than the criminal penalties, for example, theft.
Well, you talk about theft. I mean, we have a person that murdered his wife's lover. He was sentenced to 12 years in prison. In this tobacco bill, we're talking about 20 years imprisonment for infringement that are being proposed. One of the key issues is that we got to stop thinking that we are a first world country. And we need to ensure that things are adapted to the reality that we live in this country. We mustn't try to be poster child for the first world when we are a third world country where enforcement is extremely weak. We can't come up with more draconian laws when we can't even enforce the basic laws that we have right now. That is a recipe for disaster.
Yeah. And as a doctor, Dr. Letlape, you obviously, you know, when people come to you with various issues, and this is true for many things, I think. So you know, you would obviously advise your patients to quit smoking. The benefits of quitting are enormous, right? And perhaps the same will be said for, let's say, someone who is going through a period of grief and they choose to take certain medications that might be addictive but provide comfort in the moment. Are those two sort of comparable situations that in the medical profession it's about comfort as much as it is about your health?
Remember, those are different situations. When you are in a situation of grief, none of us choose a grief situation. When you pick up a cigarette, whatever the factors that lead to it, you are making a choice. Whether it's peer pressure, you are making a choice. It becomes a lifestyle choice. Whereas grief is not a lifestyle choice. It's something that all of us would want to avoid. But as a medical doctor, when you come and you have an addiction, the key issue is to try and help you overcome that addiction. So the advice would be, you must quit. But remember, the harmful effects of tobacco are on those that can't quit. So the key question then becomes, if you can't quit, how can we help you? That's our approach as physicians. Now, fortunately, since around 2003, there are now viable alternatives for those that cannot quit. And we need to be able to ensure that they are given the credible information so that they can make informed choices. The science behind all these things, some of these alternatives have been studied by the relevant scientists in those fields. And even though the best thing you can do for yourself is not to smoke, not to inhale anything into your lungs, if you love nicotine, there's a duty to show you safer alternatives to get your nicotine.
Yeah.
And science has moved on. We now have the equivalent of what are called nicotine pouches, which are almost the equivalent of nicotine replacement therapies. So what we cannot do is to dig our heads in the sand and not provide people with information. Going back to the issue that you raised about cigarette smoking on the pavement, what we now need to realize is that there are other ways of people accessing nicotine which are not as harmful to them as combustible cigarettes. And some of them pose no harm to innocent bystanders like me and you.
You're talking, I imagine, about one of the examples being something like vaping, right? Whereas if you light up a cigarette, there's the issue of secondhand smoke to those around you. But you're saying there's no harm to non-combustibles like vaping. The other issue, Dr. Letlape, is that the bill is called the Tobacco Products and Electronic Delivery Systems Control Bill. So it's a bill that is targeting smoking in its entirety, whether it's combustible or electronic.
Well, the bill has a problem. How do you describe smoking? When I have a pouch that I put into my mouth, whether it's a tobacco pouch, whether it's a nicotine pouch, am I smoking? When we've had our elders use snuff, were they smoking? Or are we the ones that are now smoking by not differentiating between the two, between the different things? And that's a key problem when you treat things like they are the same when they are not the same. So the key problem with the bill is lack of differentiation. Even if you put them in one document, you need to recognize that they are not the same. And remember, when we're talking about alternatives to combustible cigarette, we are not saying they are without harm. We are saying they are less harmful than combustible cigarette. And that can be quantified through toxicological analysis of the emissions. And we need to have science-based regulation, not rhetoric-based regulation. Now, when you go to a country like Sweden, they are now looking at separating tobacco legislation from legislation of the alternatives to combustible cigarettes because the characteristics are different. So when people make an informed choice of saying, I like my nicotine, but I'm going to take it in a less harmful way, do we meet them halfway or do we lump them all together? Where the person that is using a heat-not-burn product, that is using a vaping product, or that is using any of the other alternatives, now has to sit in the same space as those that continue to use the most harmful way of getting your nicotine, a combustible cigarette. Are we encouraging people to switch to less harmful ways? There's also studies that have shown that a lot of people that have wanted to quit completely have been able to quit cigarettes by going to an alternative. And some of them have left the nicotine habit completely. But they had tried many times to leave tobacco cold turkey, to utilize the methods that have been available with psychotherapy, with psychological counseling and support. And the relapse rate is extremely high. There have been studies that have been done, Cochrane reviews, that have shown that vaping in particular offers a far better method of people moving away from combustible cigarettes than all our conventional medical therapies of nicotine replacement therapy.
But Dr. Letlape,
what we need to do is to look at the science.
Dr. Letlape, we know very little about the impact of vaping, don't we, on the body?
We know the impact of vaping. And remember, the reference point is combustible cigarette. Mm-hmm. So we know how people that have been smoking, how their health improves when they switch to vaping, heat-not-burn products, or pouches. There's scientific evidence, there's clinical studies that have been done. There's a university in Italy, University of Catania, with a researcher called Professor Riccardo Pelosa. They have done many studies on improved health of people that switch from combustible cigarettes.
But it's harm reduction,
so
isn't
we
it?
can't talk about, we don't know what's going to happen in 20 years. We know the difference that happens to a person's health when they stop combustible cigarettes and use less harmful ways of getting their nicotine.
Yeah, it's harm reduction, but it's not without harm, I suppose, is the point.
That's the point. That's what life is about. You know, when you're a diabetic, we give you insulin to reduce harm. We advise you on reducing sugar intake. We can't make you devoid of harm, but we can help you. When we've had the pandemic of HIV and AIDS, we can't stop people from having sex. If you all stopped having sex, we wouldn't transmit the virus. But we're not going to do that. We give you post-exposure prophylaxis if you are in an occupation where you cannot avoid it, because it's going to reduce your chances of getting infected. We say use a condom so that you can protect others if you are positive. We say take ARTs. They are not going to cure you of HIV, but they are going to reduce your ability to transmit the infection and infect others. We are reducing harm. We are not eradicating harm. When you are on cocaine, when you are on heroin, we give you methadone. Methadone will still give you a high, but it's less addictive. We can titrate you down. We are reducing harm. We are not eliminating harm. Why are we evangelical when it comes to tobacco? Mm-hmm. When we are not evangelical when it comes to heroin? We tell people, reduce the harm of alcohol, reduce the percentage of alcohol. We even encourage alcohol manufacturers to create 0% beer. Now, why are we not using all that we know for people who smoke, to whom the most preventable deaths are tobacco-related deaths. 1 in 2 of people who continue to use nicotine in a combustible manner will die from that habit 30, 40 years later of use. Why are we not offering them the knowledge that there are less harmful alternatives if they cannot quit?
Yeah. And I suppose we would argue there's no way of eradicating harm in life in general, is there? Dr. Letlape?
Oh, yes. You know, cars kill us.
Yeah.
And nobody has said we must stop driving in cars. So we do things in cars to improve their safety.
Right.
The braking system, safety belts, airbags, crash zones, even for pedestrians. You know, we have pedestrian detection systems in modern cars. Nobody says quit cars because cars kill.
Indeed.
You say, how do we make them safer? If you can't quit using nicotine, how can we reduce harm to you?
And I think
it's just the